The top health concerns for the state of Louisiana are reported by the Louisiana Department of Health. In 2017, these are heart disease, stroke, cancer, diabetes, opioid addiction, and sexually transmitted infections. Because of the increasingly alarming STI rates, the healthcare focus of this group is STIs in the Baton Rouge area. All incidence rates for STIs in Louisiana are significantly higher than that of the national average in the United States. These are also much higher than that of southern states such as Alabama, Arkansas, Mississippi, and Texas. The chlamydia incidence rate in the Baton Rouge region was 4,052 per 100,000 persons. Gonorrhea incidence rate was 1,513 per 100,000 persons. Primary and secondary syphilis rate included 106 per 100,000 persons. The congenital syphilis rate in 2016 in Baton Rouge was 23%, which was the highest percentage in the state of Louisiana. Human immunodeficiency virus, or HIV, is an associated concern with high incidence rates of STIs, as those with STIs have an increased in risk for contracting other infections such as HIV. The HIV diagnosis rate for the Baton Rouge region was 233 per 100,000 persons. There are several risk factors for contracting a sexually transmitted disease. One of the biggest risk factors is age. This is why we specifically chose to focus on those 15 through 24, as these are at the highest risk in age category. Men that have sex with men, unprotected sexual intercourse, multiple sexual partners, illicit drug or alcohol use, and trading sexual favors for money are all also risk factors for sexually transmitted infections. Having a sexually transmitted disease also increases the risk of contracting another sexually transmitted disease, as well as engaging in sex with a partner that is at high risk. Lastly, people that live in areas that have a high prevalence of sexually transmitted infections are more likely to be exposed. With the prevalence of sexually transmitted infections being so high in Baton Rouge, the entire population is at an increased risk of contracting a sexually transmitted infection.